Hello, welcome to our 2021 Black Health in Washington briefing, organized by the Tubman Center for Health and Freedom and our partners. Welcome. My name is Abbey. I'm the CEO of Tubman Center for Health and Freedom. We're a health justice organization committed to the principles of healing and people's liberation from the systems that make us unwell. I want us to acknowledge the indigenous people of this land in which we all reside on. I'm currently zooming in from the Duwamish territory, a tribe that has never received federal recognition. As a public health institution, we do not forget the federal government's treaty, promises, and obligations to provide health care for the indigenous people of this land in exchange for the land taken from them. And we also acknowledge the present day failures of all obligations to our relatives. Today in the United States, a Black person dies prematurely every 7 minutes. Health inequities, particularly those that impact Black community, are well documented and mirrored at the national and local levels, including here in our own state. I welcome our guests today to speak about the solutions as well as the things that they're seeing that we can do here, right here in Washington State. Welcome. I'd like to hand it off to our first speaker, Denise Jefferson Abbey.
Morning, and thanks for having me. My name is Denise Jefferson Abbey, and I'm the COO and founder of the Tubman Center for Health and Freedom. We are a Black and Indigenous grassroots founded health justice organization that is building a community health center from the ground up. We're working with community to really reimagine what healthcare could be if marginalized people were designing every aspect of it. You know, we have tons of literature and research that supports what Black communities have been saying. We have decades of data showing that existing healthcare delivery is not working. We know that 80 to 90% of one's health is determined by their conditions. And we can look at all of the health indicators across the state to know that Black health is a crisis in Washington State. African Americans rank the worst, or at least among the worst, for maternal mortality, infant mortality, asthma rates, cancer rates, food insecurity, evictions and homelessness, unemployment, COVID cases, and overall life expectancy, you name it. While some may look at these statistics and point to income inequality as the driver, while that is a very important, incredible driver of poor health as well, that is not the main one. When it comes to Black health, many data sets show that even among high-income African Americans, they face poor health than low-income whites. And that's certainly the case with maternal health and cancers. Racialized weathering is also a well-documented biological response. We have science that shows that exposure to racism impacts us on a cellular level. The science exists. Yet the solutions are still hard to come by. Racism and long-standing institutional divestment and counter-investments have led to a crisis in Black health across the state. And COVID has illuminated this for many. Last year we heard recognition and proclamations that racism is a public health crisis. We'd like to take it a step beyond that and be even more explicit today and say that Black health is a public health crisis for the same reasons. Our communities have existing expertise. We have community resources and generations of experience working and improving our conditions. Those are not lacking. What is lacking are meaningful public investments into these institutions, organizations, and solutions that do work. We need deep, meaningful investments alongside that to change the tide, to address the upstream factors and root causes of social determinants of health for those across our state. I invite you all to engage with us, the Tubman Center for Health and Freedom through our reimagination of healthcare. We need healthcare that addresses those clinical concerns as well as those social determinants of health. And I implore you to take bold, decisive action to improve the health of Black Washingtonians.
I really resonate with that. My name is Jasmine Bryant. I go by Jazzy B. I use she, they, jazz pronouns. I'm a birth justice organizer at Surge Reproductive Justice, and I am a full spectrum doula in community, doing birth, postpartum, sibling sleep, and now lactation support. Black health is a crisis. Black perinatal health is a crisis. And we know this because nationally, Black birthing people in the United States are 3 to 4 times more likely to die from pregnancy-related complications than white birthing folks in the United States. And we know that King County is not an exception. And we see that through our infant mortality rate. Infants born to Black birthing people died at a rate of 2 times that of King County overall, about 7.8 per 1,000, according to the Washington State Department of Health. And we know that those poor outcomes are due to medical and systemic racism because those birthing institutions were never made for Black birthing folks. We also know that Black birth doulas and birth workers are already doing the work to address that gap in care for their communities through non-medical ancestral healing practices. We see a solution in equitable access to doula care. The Doulas for All Coalition is improving equitable access to culturally congruent, preventative, holistic care by seeking Medicaid reimbursements for birth doulas. And if you're not familiar, a birth doula is a person that's a non-medical birth coach or support person trained to provide physical, emotional, and informational support to birthing persons during labor, birth, and the postpartum period. And for BIPOC folks, for Black and Indigenous folks, this is also looking like remembering ancestral birthing practices because we know birth is more than a medical event and that we are dying when we are medicalizing this event. In 2017, a study showed that birthing people who had continuous labor support, that is a person that never left their side, both the birthing person and their baby are statistically more likely to have better outcomes. And we also know that over 50% of the births in Washington are covered under Medicaid. So this math is doing itself in my mind. We need Medicaid reimbursements because birth doulas are not a luxury. They're a necessity when we're talking about advocating against medical racism in birth spaces and preventing poor outcomes for our Black birthing people and their babies. This year, the Doulas for All Coalition has been working on presenting a bill that will establish birth doulas as a profession in Washington State through a voluntary competency-based certification pathway, which will allow for reimbursement. And we need it to be voluntary because we need the state not to take ownership over ancestral practices like they have tried in the past. So if you don't want to be enrolled in the state credentialing program, you don't have to be a birth doula. But for reimbursement purposes, we need a pathway. And so to really address the Black perinatal health crisis in our communities, we need to support the Black birth workers who are already addressing the Black perinatal health crisis in our communities. We need to support the Medicaid reimbursement bill so that we can do that investment in alternative forms of healing that are doing the work of addressing Black health.
Thank you, Jazzy. I'd like to invite Will to share.
My name is Willhauser. I am a member of the Washington State Commission on African American Affairs. I prefer he, him pronouns. I think the question is an excellent question, and the need for improvements and commitment to Black health can't be underestimated. Like you've pointed out originally, every 7 minutes, someone of African descent is dying prematurely because they're not receiving the healthcare and services and resources that they need to actually survive and be healthy. I think the work that Tubman Health is doing the importance of it has obviously been increased due to the pandemic. And I think during the pandemic, disparities in healthcare services committed to our community became even more apparent. We recognize that many issues, for example, during the pandemic, many of us weren't receiving healthcare services or relying on poor information just because we didn't have a trusted medical professional to lean on. Many of us don't go to, when we get sick, we go to the hospital. And when you go to a hospital when you're sick, as opposed to a primary care physician, you don't build a relationship with that physician in the ER. That physicians in the ER are interchangeable, but your primary care physician is pretty consistent. And many of us, since we don't have that primary care physician, we lean on physicians in the ER. We don't build those relationships. And when you don't build relationships, there's a lack of trust, and sometimes there's mistrust. As a result of that, many of us have refused treatment. Well, during the pandemic, we were looking at, and I'm being on the Commission on African American Affairs, we're looking at a slew of healthcare issues in the African American community. And one thing I recognize is that African American men were not receiving core treatments like prostate, which is something that many of us deal with when we get into our 40s, and we should be getting that checked out. And we see many brothers dying prematurely because they're having issues with the colon or the prostate, like Chadwick Boseman just a few years ago. And so some of that stuff can be actually addressed, and it can be addressed by supporting Tubman Health and the work that they're doing, and increasing the bandwidth of Tubman Health, so we can actually go into communities and reach those people who aren't receiving the services they need. If someone is dying every 7 minutes in this state, then we should be doing everything we can to outpace the death rate that is occurring, primarily because folks don't have the information or resources that they need to be healthy.
Hi, everyone. I'm Jaconda Nelson. I'm president of the African American Health Board, which is one of 16 cultural and ethnic health boards in Seattle, King County, doing work across the state of Washington. The African American Health Board advocates for anti-racist, accessible, and community-centered approaches to well-being. We work with community, we work with healthcare institutions, partners, community-based organizations to achieve health equity by impacting policy and systems change and demand institutional accountability. Our vision is a community where all African Americans are healthy, thriving, and able to reach their full potential. We believe that community should be centered in healthcare and decision-making. We believe that if community is centered, outcomes will be better. We also believe that leaders representing historically underserved communities and underinvested communities should make up more than half of any decision-making body, whether it's in healthcare institutions, in community, and other ways that health is being provided or programs are being created. We understand the need for broader sector representation, but equity truly means shifting the balance of power to make sure that those who are most underinvested in and oftentimes overburdened lead in those spaces. We also believe that community workers who are already doing the work, who are living everyday experiences, who are equally serving and giving care in other ways to communities should be hired and paid for their work. Oftentimes we see where people want to partner and they want to bring people in for focus groups or other ways, but not paying people for the services that they're doing for organizations that they should already be doing themselves. And so we want to make sure that there is a prioritization for those who have the greatest needs, who are closest to the issues that serve, and oftentimes have the solutions and the treatments that are needed to provide the best care for those in the Black, Indigenous, people of color community. So we believe in the work that Tubman Health Center is doing, all of the partners are doing, and we will continue to be committed to advocate for resources, to advocate to build capacity, to do this work for the people who need it most. Thank you.
My name is Ben Danielson. I'm very honored to be in this group. I'm happy to be here. I'm a pediatrician and I guess in performative ways part of the University of Washington, in meaningful ways part of Seattle's Black community. You know, Ine, you and others have taught over and over again some of the real basic and very clear lessons that when Black mothers who are expecting come to Black and brown doctors and nurse practitioners and midwives, the outcomes are better. So there's an obvious and straight up direct solutions there. Youth incarceration to me is a very downstream and terrible marker of the ways in which we devalue Blackness, especially in this country, or we are so maybe afraid of Blackness that we seek to either erase it, push it away, create a space where it is caged and disempowered. And that comes from so many different places and is so clearly a result of the stuff that I thought I was being trained as a physician to help address. And it's become so clear that the intersection of all of our lives and work with some of the worst outcomes in our society, like youth incarceration, have some very direct lines. We need to end and stop doing the things that we know are harmful, the things that we all agree and know, and the evidence and every kind of wisdom shows are harmful. We need to stop that. The process of stopping that is the process of living more deeply into every early piece of informing, of healing, of building, of supporting, and of loving our children that our work, our shared work, is all about. I name youth incarceration as a near end harm in order to focus on the many things that happen well before that and happen in cycles for generations through that we should be focusing on.
Thank you all for sharing your insights. In reflecting and hearing on what others have said, are there additional comments that you would like to share with everyone?
Again, when we think about whose voices have been centered in the work, we believe that Black voices have not been centered when it comes to data collection, when it comes to story collection, when it comes to specific outcomes. Even within the Black community, there are different experiences that come with that. And so we are proposing and building our capacity to complete a Black community health needs assessment so that we get very specific around what are the specific healthcare needs, not just in the healthcare provider space, but also the communities in which people live, the access to basic living, needs around food and shelter and childcare and education. And so as part of that collective work, we are again positioning our organization who has connection again to community for people who are within these communities doing the work and best position to find the need or to find the solutions and bring forth the solutions, as well as looking at when we're thinking about the future of healthcare centers for Black, Indigenous people of color, where do we need to position those centers so that we are serving those who are furthest away from opportunity and to be able to provide true equity for folks who need access to healthcare and other living needs. One thing we see in the African American Health Board is a lot of partners come to us. They want to have roundtable discussions. They want to have focus groups with us. They want to have connections, get feedback. And that's great. But we are now beyond that, right? When we think about the fact that Black people are dying prematurely every 7 minutes, that is beyond the point of talking. We have to have action, intentional action that is backed by resources, by dollars, by people, paying people who are doing the work. And that's the only way that we're going to be able to move the needle, to be able to not even catch up, but to start being more accountable to the work that we need to do so that we can protect the lives of Black folks who are dying prematurely every 7 minutes.
I think as we engage politicians who come into our communities, and they want our votes, there should be an exchange. It shouldn't be a one-sided relationship. The relationship should be symbiotic. If we're exchanging votes, if we're exchanging time, we're exchanging energy and effort with our local leaders, then they should be giving us something in return. The life expectancy of this community is of the utmost importance. And some studies show that it has decreased by 3 years during the pandemic.
Yep.
So as we hold a forum and give folks an opportunity to engage with us, the exchange, there should be something in exchange for our time, energy, and effort. And it should be in the commitment to our community and improving the health of our people. And I think that we are sharp enough to identify critical markers in terms of data to prove whether the work that is being done is actually working. And I think it's up to us to hold our leaders accountable when our community is failing.
I like the point that folks were making that health is in all things. We have over 183,000 public employees in this state. And most of the time we get relegated to a certain department or a certain DEI person. And so if those are the minimal things that is doing anti-racism, anti-oppressive work, well, there are 183,000 other people. What are they driving? And so we have to kind of flip the narrative to say, again, when we think about resource, it's not, you know, the small amount that got designated for us. Is that apartheid? Is that drinking from the coloreds only water fountain, right? We have to really think about the totality of the whole pie and what resource is being used in the public sector to drive these disparate health outcomes that lead to a Black person dying every 7 minutes.
I wanted to say something also about, I look forward to this future where our own inherency is its own value, not in relationship to others. Let's just be clear and say, I don't know if I even want the same health outcome as white people in this country. And as long as we're comparing ourselves to that as some standard, I think we're always going to be in a position of being disenfranchised, set aside, and losing. I hope for a higher standard that we name ourselves, that we are resourced for, that we have the ability to make decisions upon, and that we are responsible for, and that we perform on. And then maybe there'll be a day, I look forward to a day when some white community says, how do we catch up with them Black folks and really have the same kinds of thriving communities that they do? We even still define our health relative to systems that don't care about us. When wellness is defined by our relationships, by our connectedness, by our communities, by us, then we will be starting to experience, I think, what Tubman inspires in me, a sense of liberation health, not just sort of comparative health. And that's where we need to keep pushing ourselves.
I'll jump in and just add that, you know, health is impacted by so many different industries. And I mean, in a very practical manner, so many different state agencies and budgets. We can't have a single pot of money to solve for Black health that sits in a single agency. We need every single state agency to make proactive investments to counteract the decades of disinvestment and counterinvestments that have been made in our communities. And so I would just implore decision makers to take action no matter what committees that you may sit on. There is a place for you to take proactive steps to advance the health of Black Washingtonians.
Thank you to all our speakers, and thank you to those who are watching. Our speakers provided great insights into health for all Washingtonians, and I hope you found this informative as we head into 2022 and the 2022 legislative session. Thank you all. Happy winter holidays.